Welcome to my channel Wellness Wisdom. In this video, we are going to talk about a very common heart condition, coronary heart disease. What is coronary heart disease? Coronary heart disease and coronary artery disease, these two are different names for the same heart condition. Heart is a muscular organ. It is supplied by blood vessels called coronary arteries. Coronary arteries supply blood that is rich in oxygen and nutrients directly to the heart muscle. In this way, our heart gets energy for all of its activities. In case of coronary heart disease, coronary arteries are unable to supply adequate amount of blood that is containing oxygen and nutrients to the heart. How the problem starts. The problem starts when cholesterol, fats, and other substances begin to deposit inside the walls of coronary arteries. This process of accumulation is called atherosclerosis. Atherosclerosis will result in plaque formation. Plaques are composed of cholesterol, fats, inflammatory cells, calcium deposits, and other substances. When plaques build up inside the wall of coronary arteries, arteries become narrow. Blood flow to the heart decreases. Heart does not get enough oxygen and nutrients. It has to work with a less amount of oxygen. Symptoms start to develop. There will be pressure like pain in chest or tightness called angina, shortness of breath, extreme fatigue during physical activity, and if coronary artery is totally blocked, it will cause heart attack. Heart attack is a severe manifestation of coronary heart disease. It happens when plaque ruptures inside the wall of coronary arteries. When plaque ruptures, it will form a clot. Clot will block the blood flow to the heart. There will be a sudden decrease in the blood supply to the heart. Heart does not get enough oxygen and nutrients. Heart cells start dying. It's a medical emergency. Heart attack, also known as myocardial infarction in medical terms, its symptoms are crushing chest pain, pain in shoulders or arms, shortness of breath, and sweating. It is important to know about the people who are at greater risk. Older people, they are at increased risk because in older age, arteries become thick and narrow and damaged. Men, they are more prone to develop coronary heart disease as compared to women. Women, they also have a greater chance to develop coronary heart disease after menopause. And some health conditions like high blood pressure, high cholesterol, diabetes, and obesity, they are associated with increased risk of developing coronary heart disease. Lifestyle also matters, like unhealthy diet, physical inactivity, continuous stress. They all contribute to develop the disease. Smoking and family history are also important risk factors. How will you diagnose coronary heart disease? History, physical examination, and blood tests are some traditional ways. There are three important tests for coronary heart disease. Number one, stress test, also known as an exercise test or treadmill test. It is monitored through ECG or electrocardiogram. Patient walks on a treadmill and during that period, patient's blood pressure and ECG are monitored. At the end of the test, ECG is analyzed to detect any signs of coronary heart disease. Second important test to diagnose coronary heart disease is called an echocardiogram or an echo. It is a non invasive imaging test and is done to evaluate heart structure and function. Third one is cardiac CT scan or coronary CT angiogram. It is also a non invasive imaging test. In this test, X ray and computer technology are used to produce detailed images of the heart and its blood vessels. If any of these three tests show signs of coronary heart disease, then patient is prepared for cardiac catheterization. It is a minimally invasive procedure. This test is also known as coronary angiogram or heart cath. In this test, a dye is injected through catheter to visualize coronary arteries and heart chambers. X-ray images and other imaging techniques are used to visualize heart and its blood vessels. Coronary heart disease can be prevented. We can tell our friends, family, and loved ones to adapt a healthy lifestyle by eating healthy diet, by losing weight, by doing regular exercise, reducing stress, and quitting smoking. Treatment of coronary heart disease includes both medicines and surgical procedures according to patient's medical condition. Most commonly recommended drugs are aspirin, cholesterol modifying drugs, and beta blockers. Surgical procedures are including angioplasty, coronary artery bypass, grafting, and stenting.